Senator Manchin.
Mr. President, first of all, I want to say to my colleagues, Senator Markey from Massachusetts and Senator Blumenthal from Connecticut, this doesn't have a partisan home. This is not a Democrat or Republican issue. This is an epidemic that's devastating our entire country. It doesn't matter whether you come from affluency or socioeconomically basically challenged. Rich or poor, makes no difference. What side of the track you live on makes no difference. This is an epidemic that hits us all, and it does devastation. When you think, if you just talk in your communities to your law enforcement, they'll tell you over 80% of all crimes are drug-related. Look at the cost, look at the economy, look at the devastation of lives that it's taking. So something has to be done, and we're expected to vote to confirm the President's nominee for Commissioner of FDA, Dr. Robert Califf. Let me say about our President, President Barack Obama. I think that he's taking this serious. He's come to the state of West Virginia. I'm very appreciative of that. He has seen firsthand the devastation it has taken to all aspects of life in West Virginia. We're a state that's hit us hard, if not harder, than most any other states. It's the #1 killer in my state. I have more people dying by legal prescription drug abuse than any other cause. So the President came there and he saw that. I'm just asking the President to make that major commitment to let's have a cultural change by giving us somebody that will shake it up from the top. And I believe Dr. Califf is a good man. I really do. And he's a qualified man. I met Dr. Califf and spoke to him. And I directly asked him, I said, Dr. Califf, you've come from a culture where basically the large pharmaceutical industry that supplies these types of products to the market and expects the FDA to approve them are the people that have supported you for the last 20 years. It's just human nature. That's hard to change, and it's hard to say no to. So with that being said, I said, we need a cultural change. And I think he understands that and respects my position. I respect his. I just think he's the wrong person at this time of need for the position that we need to shake it up. He's going to continue to serve as Deputy Commissioner of the FDA's Office of Medical Products and Tobacco. But the commissioner of the agency must be someone willing to lead in a different direction. With 51 Americans dying every day due to an opioid overdose, the FDA now more than ever needs a commissioner who's a champion, committed to changing the way this agency handles opiates. As I've said many times before, my state of West Virginia has been hit the hardest. Drug overdose deaths have soared by more than 700% since 1999. We lost 600 West Virginians to opiates last year alone. That's not the only problem in West Virginia. Since 1999, we've lost almost 200,000 Americans to prescription opioid abuse. I'm here today to urge all of my colleagues that before you take your vote today, I want you to think about the citizens of your state who are suffering from prescription drug abuse. Think about all of those that you know who have lost a loved one due to this epidemic. Each and every one of us here knows someone whose life has been wrecked by legal prescription drug addiction. There's not a person, this is a silent killer. There's not a person that I know in any community, in any group, in any setting, that I can't look at and say, there's not one of you in this room that doesn't know somebody in your immediate family or extended family of friends that hasn't been affected. That's how rampant this is. But it's one that we don't speak about much. We're kind of concerned. Could be our son. It could be a brother or sister. It could be a mother or father or aunt or uncle. We don't want to talk about it. We're afraid it's been stereotyped. But we need a cultural change. And as the agencies overseeing the approval of these addictive drugs, the FDA plays a critical role in this epidemic. And as my dear friend from Massachusetts, Senator Markey, has said, the FDA might have to change what it stands for. And it really has. It's fostered this drug addiction more than any other agency. When you think that it's being produced legally, it's being approved by the federal government in a legal way, it's being prescribed in legal ways, and we have the most addicted nation on earth. 5% of the population lives in this great country of ours called the United States of America. Over 80% of the opiates consumed in the world are consumed by 5% of the world's population. Something is wrong. Something is wrong, and everyone should be concerned about this. I'll tell your children and grandchildren, Mr. President, every day when I speak in schools, you don't have to worry about another country ever taking us over military. We have the greatest military that the world has ever known. We have the strongest economy, and we're the only ones that can correct the mistakes we have made in our economy because it's so strong. They don't think they have to take you all military or worried about overtaking your economy. They're going to sit back and wait till we become so addictive we can't function. This is what we're dealing with. And this is why it's of such importance. The agency has been so calloused about their approach to this epidemic. As a matter of fact, time and time again, they have failed to consider the public health. You would assume that if the Food and Drug Administration makes a decision that something is good and consumable, that they would have looked at the effects it has on the public, the health and well-being of the citizens of this great nation. It has actively stood in the way of efforts to address the opioid abuse epidemic, not only not considering, but prohibited others from doing it. For years, the FDA delayed before finally agreeing to reschedule hydrocodone, to reschedule. Let me explain where I'm coming from. When I first came to the Senate in late 2010, early 2011, I said, my goodness, we have Vicodin and Loratab, the most prescribed opiates on the market, more than any others. OxyContin had already been moved to a section Schedule 2. And Vicodin and Loratab was Schedule 3. It took us 3 years to get the FDA to move to reschedule Vicodin and Loratab and all opiates to a Schedule 2. Took 3 years. And after overwhelmingly their own advisory committee recommended that it be rescheduled. That means you can only give out 30 days supply at one time without seeing a doctor's visit. Under Schedule 3, they could give out 90 days and continue just to call in without seeing a doctor. They were putting this stuff out like they were M&Ms. So that changed, and we finally got that done, but it took forever to get it done. We never could understand why. But let me tell you, to add insult to injury, but since that change went into effect, we've seen the number of prescriptions for hydrocodone products, such as Vicodin and Loratab, fall by 22%, Mr. President. We knew it worked because they were overprescribing it. So 22%, that's 26 million fewer prescriptions and 1.1 billion fewer pills on the market. That's how much just that one change took 3 years, should have been done in 3 weeks, took 3 years because the FDA stalled their decision making. Then, and yet, after finally making the important step, after 3 years, the next day that was done, Mr. President, the FDA approved the dangerous drug called Zohydro. The next day, after 3 years waiting to get all opiates to a Schedule 2, they come out and recommended Zohydro and approved it, even when their own experts, their own advisory committee made up of experts, recommended 11-2 against bringing this most powerful lethal drug on the market. This drug has 10 times the hydrocodone of Vicodin and Loratab, with the capability of killing an individual with just 2 pills. And just recently, the FDA approved OxyContin for the use of children 11 years of age. Can you believe that? They did that without having any experts, any advisory committee's consent or recommendation. This decision means that pharma is now legally allowed to advertise OxyContin to pediatricians under certain circumstances. Well, we have seen the devastating impact of this type of advertising, and we have years of evidence that shows that drug use at an early age makes a child more likely to abuse drugs later in life. These decisions illustrate the FDA's inability to consider public health and assess the realities of the deadly epidemic. While I recently accepted the agency's decision to finally start listening to the advice of its expert advisory committee, they have just decided now they're going to start listening to their advisory committees. No way have they committed to take basically the recommendations. They're just going to listen. Well, you might say it's a step in the right direction for them finally listening, but basically taking the advice of experts and not acting on it is absolutely, I think, meaningless. The change at the FDA needs to be fundamental, and it needs to come from the top. We need a leader who changes the current way of thinking. Unless a major cultural change is implemented at the FDA, similar instances will continue to occur under the future. Meanwhile, our nation's opiate epidemic only continues to worsen, and our friends and families are further torn apart by the impact of addiction. If Dr. Califf is confirmed today, I do not feel confident that this culture change is going to take place. Dr. Califf has such close financial ties with the pharmaceutical industry. Between 2010 and 2014, Dr. Califf received money through his university salary and consulting fees from 26 pharma companies, including opiate manufacturers. And in the past, Dr. Califf has actually described the FDA regulation as a barrier, not a safeguard for public health, but a barrier. Mr. President, I believe that the FDA needs new leadership, a new focus, and a new culture. Dr. Califf's past involvement with the pharmaceutical industry shows that he will not be that person to do that. He will not have the impact or leadership capabilities that the nation needs to stem the tide of the opioid crisis. I believe that the FDA must break its cozy relationship with the pharmaceutical industry and instead start a relationship with the millions of Americans impacted by prescription drug abuse. It is because of this belief that I am urging my colleagues to vote against the confirmation of Dr. Califf. Mr. President, my office has been absolutely flooded with stories from West Virginians and Americans who want their voices heard. I'm going to read just a couple of letters because I think it's important to know the impact of these letters. I want you to absolutely hear, and I know every state has been impacted the way my state has. This is Susan's story. My name is Susan. I am from West Virginia, and I am the mother of 3 children, ages 20, 16, and 14. My oldest son's name is Zach. Zach is an addict. Zach grew up in a small town with his mother, father, brother, and sister. He played sports, thought out his childhood, including football, baseball, wrestling, and basketball. He got good grades in school. He went to church with his grandparents and wanted to be a preacher until the age of 11 or 12. My husband and I divorced when Zach was 13, and he deeply affected Zach. We moved to a new town where Zach and his brother and sister started into a new school system. Around the age of 15 and 16, Zach started self-medicating with nerve pills.
I hate to interrupt the senator, but his time has expired.
I didn't think there was a time barrier on this, sir. I'm so sorry. I asked to continue at least this letter.
Is there objection?
Mr. President, the senator from Washington, reserving the right to object, senator from Washington has 5 minutes to go. I have 10 minutes to go, and the vote's at 5:30. So I guess I would ask
should be
the
done
chair
in
what
about
the
2 or 3
senator from
minutes.
West Virginia would.
If I could just finish this letter, sir, I'll be done. And I've got many more, but I'll come back and do them later.
The senator from Washington.
Mr. President, if I could just ask unanimous consent that following the senator's remarks that I be allowed 6 minutes and the senator from Tennessee be allowed 10.
Is there objection? Without objection.
Thank you, Mr. President. Thank my colleagues, too.
Is there objection to the senator from West Virginia's request? Without objection.
Around the age of 15 or 16, Zach started self-medicating with nerve pills, smoking pot and drinking. Zach did his first stint in rehab at age of 16. He went to Florida rehab facility because they were able to arrange everything, including his flight, before he even got a call back from any facility in our state. Zach was in treatment 60 days and returned home. He was clean for several months, then started using again. Zach graduated to using pain pills. From there, he started shooting up in pain pills. A child who had a horrific fear of needles was now injecting opiates to escape his painful reality. Zach was robbing people and living house to house on the streets. Then when he figured out heroin was a cheaper fix and more accessible, this became his new drug of choice. Zach was arrested and given the chance to go to rehab again. He completed another 2 trips to rehab, one being 60 to 90 days and another being around 30. He came home, relapsed, went to jail for 4 months due to failed drug test. He spent 4 months in regional jail without receiving one counseling session or any help without substance abuse. When he was released from jail, he was very lost, didn't know what to do with his life. He was clean several months before relapsing again. Zach is now in a peer recovery program in West Virginia. He's 20 years old and on his 4th stint in rehab. He's fighting for his life in this program along with about 120 other men. He has been to jail, has lost close to 20 people in his life due to overdoses. Being a mother of an addict is a nightmare, from learning your child has this disease to fighting with insurance companies and doctors to get your child treatment. When Zach was a juvenile, I was told by treatment providers that insurance companies did not consider substance abuse in children a life-threatening disorder. I had to run up in the house when he ran away and handcuffed him and take him to hospital high as a kite. I had CPS called on me for having my intoxicated son handcuffed because I wasn't a police officer. I had mental hygiene warrants lost. My son was released by a hospital at moderate risk to suicide, and because of that, treatment centers wouldn't even consider admitting him into their program. I was told by hospital staff that if I had a medical card instead of private insurance, or any of my children was a ward of the state, they could get him more help. I contemplated quitting my job in order to get a medical card for my son. I have been asked by rehab to take out loans in order to get my son help. I have had to borrow thousands of dollars from my family in order to get my son into treatment. I have driven my child to hospitals while he is nodding in and out, and I was crying so hard I couldn't see. I've stayed up for 24 hours in a row watching my son detox in hospitals. I have followed ambulances for miles, transferring his facilities. I have missed Christmases, Thanksgivings, and birthdays with my son. I have gone months and months without a good night's sleep. I would cringe every time the phone rang and there was a knock on the door. No mother should ever have to just wait on that phone call for that phone call on the door now. I have also had to set my other two children down and explain to them that I don't love them any less than I do their brother. I have had to tell them I have to dedicate more time to Zach because I know the two of them will be okay, but I have to try and keep their brother alive. You see, this epidemic is not affecting the person who is the addict. It is destroying families and communities. Siblings are forgotten. Marriages and relationships are being destroyed. Entire families are getting PTSD. Crime is at an all-time high. The list goes on and on. The whole system is broken, Mr. President, when it comes to treating mental illness and addiction. Until we get the money to fund treatment and more treatment centers, this epidemic will continue to get worse. I am finishing right now. It is my child. If my child had cancer or any other chronic disease, he would be able to get immediate treatment. He would be able to get good treatment. Addiction is a disease that may start with a poor choice, but is ultimately a disease. Until we are able to provide adequate treatment immediate to those suffering, we will continue to lose a generation of people. I pray that no one else has to experience the pain my family and my son has experienced. But unfortunately, this disease has entered into every community, every neighborhood, and most families. It's just a shame that we live in the greatest nation in the world, and that is our reality. And Mr. President, I want to thank you and thank my colleagues for allowing me that. I just feel very concerned about where our country is going and the role the FDA plays, and we need a cultural change. Thank you, Mr. President. Thanks, my colleagues.
Mr. President.